Hey there, it's Dr. Brian McKay, not just a chiropractor, Stamford, Darien, Norwalk, New Canaan. Yes, it's not the greatest title, and I'll always be the first to admit that. But what I'm going to talk about today is runner's knee or knee pain in general, because anytime someone has pain in the knee, you're going to call it runner's knee, even if you're not a runner. So, what basically happens is there's a lot of moving parts with the knee. It's a very stressful joint. Um, it's a hinge type joint similar to the elbow. The name applied to the joint is gingimus, Ginglmus. In case you ever need a Scrabble word, gingimus. It's a type of joint, a hinge joint. So that would be the elbow and the knee. Elbow doesn't take as much of a beating because it's not as weight bearing, and people can be active and you know not really hurt their elbow, but they can hurt their knees, especially with a number of different injuries. You can have traumatic injuries, stress injuries, overuse, a lot of different ways to hurt your knee. It could be overweight, sedentary lifestyle. So basically, just about anything can cause you to have knee pain. You don't have to be an athlete. You don't have to be a runner, a cyclist, whatever, to have it, but it is very, very common. So what happens? You go to your doctor and he tells you, well, you can take these anti-inflammatories. That's going to you ice it up afterwards, and that's going to be the initial course of action or course of care. But what happens if that doesn't really work? And listen, sometimes it works. If it's going to work for you, you're not going to be listening to me talk about runner's knee or knee pain. They're pretty much synonymous. Very interesting thing is, there's a Harvard Medical School did a study, and it's more common in women, especially women in middle age. And I think it has something to do with the angle of the pelvis, especially after childbirth. The angle of the pelvis changes. So that's going to put tension onto the meniscus, which is the disc inside. You have in spinal bones, you have a disc hernia, you've heard herniated disc, bulging disc. Well, we have meniscus in the knee joint. And sometimes that gets irritated, especially if you have uneven forces distributed onto the knee joint. Okay. And the patella is rarely the issue. I mean, you have patella tracking issues, but most of the time it's just the amount of weight and it's not being distributed evenly across the meniscus, and that leads to wearing away of the meniscus. So it's a pretty common event. I'm sure you hear, I'm hearing about it all the time, people going for knee replacements. And knee replacements actually are a godsend. If your knee is that bad and you have to have a knee replacement, your quality of life can go up tremendously afterwards. So it is always an option for you. Is it the last option? Yeah, I would say so. And some people opt for surgeries. And that's okay. Opt away for surgery. It's not it's not a bad way to go, and it will help stop the pain. But if you don't straighten out everything else that's going on with the knee, it will wear down again, and more than likely you can have a second surgery, and that leads to ultimately probably a knee replacement. So I'm not here to talk about gloom and doom as it relates to knee, but I want to tell you about what I feel is the most proactive course of care for knee pain. Now, I'm a chiropractor. Do I treat knees? Yeah, I do. And I'm going to use alternative things to correct the knee. Okay. One of the simplest ways to, we call it a motor unit, basically from lower waist all the way down to your toes, it's a lower extremity motor unit. And if you do not have stability in the feet, that can be a major cause of knee pain. And to correct that, sometimes all you need is what's called an orthotic. An orthotic is custom made, and it helps stabilize the foot. A lot of times people have a condition called pronation and then supination. And pronation is where the foot rolls in, supination where the foot rolls out. That's going to place stress on some of the lower leg muscles. Peroneus longus brevis, tibialis, anterior tibialis posterior, the gastroc soleus, and that uneven stress is placed upon those particular muscles can cause the leg to be weak from below, and that's going to affect it, because you got to think about it. It's really, you have the femur and the tibia. Okay, fibula is not really something you see. The fibula can be involved with knee pain. It's just not that common. It's a smaller bone. That's the bone on the outside of your leg. So if you were to rub your leg, go down to your foot on the outside, that's where your fibula is. I mean, but it can be involved. You know, there's instability with that in and of itself can cause it, but we don't see that too often. So a lot of times an orthotic can be an easy bridge. Now, here's how orthotics go. You can get the less expensive ones, which is not a bad place to start because they're only like $30, $40. And you throw the orthotic in, you feel less knee pain. Hey, not a bad thing. Go for it. You know, problem solved. Or if that doesn't work, sometimes a custom-made orthotic, which tend to get expensive. You're talking anywhere from basically $300 to $1,000, if not higher, depending on who makes it. So that is not a bad way to help ease the pain on your knee. Something else we've been using with some fantastic results is some shockwave therapy. And with shockwave, it sounds, basically, shockwave is a pneumatic device that increases angiogenesis. And angiogenesis relates to blood flow. So the more blood flow you have to an area, the quicker it's going to heal. So understand, the more blood flow, much, much better. Infrared light therapy, it allows for vasodilation, which again enhances blood flow. All your healing is going to get done with the blood. All healing gets done with the blood. You do have to remove the physical barriers, but then the healing really takes place with the blood flow to the area. And you don't really have a lot of blood inside the knee, so we're talking about to the muscles that support the knee. I mean, above the knee, you have several muscles that, and the pain can really be focused onto the knee joint itself, but you have to evaluate the muscles. You have the rectus femoris, vastus medialis, lateralis, intermedius. You have the pes serine, popliteus, a lot of muscles, obturators. So you have all these different muscles, the iliotibial band, that have to be balanced out as well, because if you take the tension out there, they're going to take less force and tension onto your patella, on your knee itself. I'm saying patella, but it's not really the patella that gets damaged. Patella just floats in the front and allows for translation of forces from your upper leg to your lower leg. So shock therapy is a really good way. And it's none of these treatments are particularly painful. Trigenics is an absolute godsend in that it allows you have certain nerves in the tendon called the Golgi Tendon Organ, and the muscle, a muscle spindle cell. And these are directly connecting either the tendon or the muscle right to the brain, right to the spinal cord to the brain. So you have this really fast transmission, and it allows for the brain to control tone. Tone is that balance on the muscles that is maintained by your brain. Everything's maintained by your brain, so that shouldn't come as any surprise. But Trigenics allows reintegration of the normal neural circuits. I know I'm getting a little bit wordy here, but those reestablishing that. So say you have the rectus femoris say it's too short. Well, you have to lengthen it. If it's weak, you have to strengthen it. So if it's weak, you're going to have to work with the muscle spindle cells. If it's short, you're going to work with the Golgi tendon organs to, again, reestablish the normal motion to the brain. The brain recognizes normal motion. It takes off the tension on the muscle. So it's kind of a restart your computer type of thing. You hit that restart button, clear your cache, and you go, and all of a sudden you're on to a better moving joint, and the strength is returned and the length is returned. And those become the two issues that kind of aren't just addressed with just plain old physical therapy. Listen, got to strengthen the muscles. There's no doubt about it. Now, if you really want to strengthen the muscles in a very effective way, I use a thing called blood flow restriction bands. And again, a lot of this focuses on blood flow. So what the blood flow restriction bands do is it creates a deficit of blood flow. You have these basically elastic bands, and you tie them around your legs up as close to your thigh as possible to where the femur inserts into your pelvis. And you go through a series of weight-bearing exercises. Now, it sounds archaic, but it is phenomenal. So by creating a deficit of blood flow, it creates more demand for blood. And when you get that blood flow rush, and afterwards it kind of fills the muscles up, because muscles have to get rid of some of that garbage, some of those damaged cells. This enhances it. And when you drive blood flow to that, it's a phenomenal In terms of speed, I mean, you really do see um, very, very quickly a change in strength. The muscles become much, much more effective very, very quickly. I mean, like say you wanted to use blood flow restrictors, you wanted to have a bigger bicep, you would put it around the shoulder, right where the armpit is, and you could see it immediately. I mean, you do a couple of curls. There's usually a specific number you would do about. How am I saying? You would do about 40% of your max. So say you could curl 100 pounds, you would use 40 pounds, and you would do it 30 reps. Okay, and you take it slow, so you really want to work the muscle. You give yourself 15-second break. You do 15 reps, 15-second breaks, 15 reps, 15-second break, and another 15 reps. So you're not talking about a long period of time, and you're not talking about a heavy amount of weight. So even if your knee is damaged, you can get more blood flow into that knee joint by doing these exercises to the muscles that support the knee. So yes, you have the pain in the knee, and yes, you may have damaged cartilage in there. This is a great way to speed the healing process up and see almost instantaneous results. Not in pain's not going to go away immediately, but you will see strength that you haven't seen. And here you are only using 40% of your max. Not a bad way to go. You also have to consider non-steroidals. Tylenol to some extent, but Advil and Aleve to help take out some of the swelling. They're effective. And if you want to use ice afterwards, it's another effective way. But to correct it, we have a device called a Neon Track, and it's a incredible device. And what it does is it allows for enhanced production of synovial fluid. And if you don't know what synovial fluid is, that's the fluid inside your knee. In the spine to the disc, you have cerebrospinal fluid. In the knee, you have synovial fluid. It's produced within the knee joint. And the Neon Track stimulates production of what we call glycosaminoglycans. And the glycosaminoglycans are a substance that help hydrate. Glycosaminoglycans are throughout the body. They're in joints, but as it relates to the knee joint, what it does, it helps attract water molecules. So you want to hydrate the meniscus, because think of a sponge where you have two sponges. One you lean on and they're both wet. One you lean on and the fluid comes out. That's your damaged knee. And the other one's fine. You can press on it and really nothing happens. So just think about a special way to increase production of synovial fluid. And the more synovial fluid, the less inflammation you're going to have, and actually the better distribution of synovial fluid by removing the stress on the knee joint, especially through the Trigenics. It's a phenomenal technique, and it does wonders. And you'd be surprised at how fast you can heal a knee if you take these different steps. Now, of course, aerobic exercises are important. But if you got a bad knee, switch it out to stationary bike or elliptical trainers. It's just a lot less stress on the joint. I mean, you can even do the rowing machine. That's not going to hurt it. But you're kind of taking the weight bearing off as much and just allowing the muscles to work. So core health, we try to find different ways to help people, better ways to help people, and so again, using a quick rundown: orthotics, the custom-made shoes, the shockwave therapy for increased angiogenesis, the Trigenics to reconnect the muscles and the tendons to the brain, blood flow restriction, enhanced blood flow, the Neon Track for the production of synovial fluid, absolutely amazing. And you use non-steroidals and a little bit of ice, and you get better with your knee. It's a great way to avoid knee surgery and especially avoid knee replacement. If you have any questions, I know I'm a chiropractor, but I do know a lot about knees now. Give me a call, 203-656-3636, 203-656-3636. Hey, thanks for listening. I hope you've learned something, and hopefully you'll listen to my next podcast coming soon. All right, listen, have a great day. Dr. Brian McKay, Core Health Darien.